When you guys are coming on, you're all muted and your cameras are off because I'm recording this, just a heads up. It's going to give it a few more minutes for everyone to jump on. We have a large group of everyone. So when you guys come on, you're muted, your camera's off. If you want it on, it's up to you. Just going to give it a couple more minutes and then we'll get started. I'll give you guys an update on everything, all the changes, and see where I can help you guys out. Just going to give it a couple more minutes and we'll get started.
To the audio conferencing center. Please enter a conference.
All right, I am going to get started. I'm going to record this just in case you guys need to refer back to it. And now I have learned that Teams isn't friendly with recording. So once I record it, I will throw it in YouTube.
Please record your name and then press pound.
I'm going to mute you, Carol. For some reason, it's pulling you in. So I'm going to record this. I'll throw it on the YouTube channel and I'll send it out to everyone afterwards. So hope everyone is doing well. Hope everyone had a good weekend. So I want to kind of catch you up to speed on everything that is going on. From a contract standpoint, we're kind of right now just waiting. It's the fun part of if you've done your contract part in Spark and you've requested some of those carriers, you basically are going to sit and wait. And the reason for that is you guys are coming into the craziest time of the year for contracts. Basically, all the carriers in the month of July go in blackout. And what that means is every agent that's trying to move contracts, get new contracts, is all coming at once. And so basically what happens is you request it, you and another 25,000 agents, and then things sit and wait until the carriers catch up. So normally the process moves quicker. Right now, I think a lot of you are going to probably see things are going to be pretty slow over the next couple of weeks, trying to get all these contracts moved around. I know also talking with Mike, he's working with his contacts at UHC. I actually just perfect timing. Had the leadership from UHC in my office Friday, no, last week, maybe Thursday. And so I gave them a list of all the agents we're trying to get things moved around for. So between Mike and my contacts, hopefully we can get everyone's UHC contract transferred under us. That's obviously pretty important to all of you. Um, Now, a lot of you requested other contracts. What I can't see is which contracts you guys have requested. So I want to show you guys a screen, and I want to make sure that all of you have requested the carriers you want. Because what I don't want to happen is you reach out to me in October and say, hey, I need to get this carrier. Because in some situations, we might not be able to do it. So some carriers literally will not contract new agents come like October, some are even September. Now, a couple of you have requested contracts that we don't have that I am getting, like Independence Blue Cross, Braven, Horizon. We are working on those carriers and I will have those. So I just signed off on Horizon, Braven this morning, which is New Jersey. I don't know what other states they're in, but we're adding that one. We did Independence Blue Cross last week, so we'll have that one. So if there's carriers that, and I'm going to show you my screen here in a second, and you're like, hey, I need this carrier and I'm not seeing it in my list that I've requested, we're probably doing it outside the platform, but I just need to make sure I'm aware of it. So kind of just working through all this. So I want to show you guys, and Marcia, you're going to be my guinea pig on this because I just had your screen pulled up. So I'm going to show you all something. Has anyone not got into Spark to request contracts? And you guys are on mute, so if you want to unmute yourself, and whoever hasn't, I can take it offline with you.
I have not, Dustin. I just finished. This is David Richardson. I just got
Okay.
everything finalized with you late last week and didn't have a chance to jump after it. So that's big on my agenda for this week.
Okay. All right. If you get stuck, David, just let me know. If anyone else hasn't, and whether you can't find the mute button, whatever, just shoot me an email afterwards. But you guys should be able to log into Spark now. And when you log into Spark, let me go into your view. If you go to, if this is what your guys' Spark should look like when you log in. If you want to follow along, you can. But you're basically going to have your name at the top. And today we're going to kind of walk through everything on here. So I'm going to spend a lot of time on Spark today. So take notes if you want. This is being recorded. I'll throw it on YouTube so you can access it. But we have trainings literally every Tuesday. We actually have another one tomorrow. But I will train you guys so you don't have to deal with that. But if you go on here, click on Back Office, and then click View Carrier Contracts. You guys should see under Pending Carriers, a bunch of them there. What I want to make sure is if there's carriers under pending missing, those are the ones you can email me about. If you're like, well, I need Clover. I know someone just texted me. I need Clover. I don't see it. You won't actually be able to request it till we get it approved. So right now we're requesting Clover, so then we can get you guys going. Independence Blue Cross, Horizon Blue Cross, Braven. There's a bunch of these carriers we're getting, but if you don't see it, I'm building out an Excel file for all of you to track everything. So if you're not seeing a carrier under pending, I don't think you guys would have any ready to sell contracts yet. But if you don't have a carrier listed under pending, please send me an email and say, hey, I'm missing Independence Blue Cross or Clover, whatever it is. I'm going to have an Excel file that I'm going to show Mike kind of here's all of the carriers that we've gotten appointed for each agent. Here's the statuses. We're going to track all of that for you just to make sure we get this through. So I'm kind of going to handhold you guys through the contracting because that is the worst part of trying to get the agencies set up. You guys think you hate contracting. I hate contracting more than you could possibly imagine. So, but we will get through it together. What's going to happen then as you request the contract? So Spark is the back office, basically. All Spark is doing is tracking things. Once we request the contracts, you're actually going to get appointment paperwork from these carriers. So you're going to get a lot of emails that you've probably already started realizing. In those emails, you're actually going to see some like for UHC, or eventually once we get this up and going for UHC and Mike gets the releases, you're going to get emails from UHC to actually do a new contract. Same if you requested Humana and Aetna, you're going to receive contracts to complete. So not just in Spark, you're actually going to get from the carrier directly. So this will be important to keep an eye out. And I have no problem if you're like, I don't understand this, I need help. I know some of you have already reached out to me. You guys can call me, we can jump on a Zoom call, we can share screens. I'm open to doing one-on-ones. I also have a contracting team, so if we need to get them involved, I will. But for right now, I'm trying to keep your guys' life a little easier by working just through me. Okay. Any questions? Yeah. So if you do have questions, you can also throw them in the chat. On the top of your screen, you should see a button where you can throw them in the chat. I'll just say hello, so you see it, it'll put a red dot on it. You guys can type questions in there too if you want as we go through this. But what I want to go through is I'm going to assume that you guys, for most of you, you've been able to get into Spark. I'm going to kind of walk through Spark today, some of the things that are important. I'm going to show you guys how to run quotes, and we'll kind of just go through this. Yes, a lot of you are going to sit here and wait. That's kind of the fun game at this point when it comes to contracting is we rush to get everything going, and then we do nothing. And I am pushing. I know someone emailed me saying, "Hey, I didn't receive anything from Aetna or anything." It's going to be a slow process. Actions that say complete contracting, that means at some point you're going to get an email to actually do the contracting. More than likely at this point, you probably have not gotten a lot of contracts by email because they're so far behind. But you will start, so you might get something for United Health. Now, I know a lot of you have received emails from United Health saying your transfer has been denied. That is something Mike and I are working on the back end, so don't worry about that for now. We're working on that. Contract certifications for to flip to RTS, I would say right now is probably 3 to 4 weeks. Once you do your certification, normally it's like a week, but right now these carriers, usually I get like a file from like Humana every other week, and I haven't received anything in like 6 weeks. So they're just way behind on pretty much anything to do with contracting. But my goal is to have you guys ready to go with every carrier by September 1st, where everything is good. That gives us a little bit of lean time just in case some things happen in September. But we'll push forward on this stuff, and I'm pushing the carriers on my end as much as possible. All right, so I'm going to go back to your home screen. So when you guys log into Spark, if you haven't, I recommend it. I always tell agents, use yourself as your test client so you can kind of see what everything looks like. So today we're going to do a couple things. I am going to, and some things you might not be able to do yet because you don't have any carriers in there. So I'm going to show you what you should be able to do today versus what you're going to eventually want to be able to do. So the first thing we're going to do is mess around with settings. I want you guys to get some of the basic things set up in the system. And the first thing I don't want you guys seeing when you come in is our logo, because we don't want your clients seeing our logo. There's no reason for them to see our logo. So we're going to clean some things up. So the first thing, if you're in there, I would just follow along. I'm going to go pretty slow. If you can't get in, we'll talk about that another day, and I can always, you can rewatch this or you can call me and I can walk you through it. The most important thing is once you're in is you should see your name at the top. You probably aren't going to see any production here. We're going to click on back office. So I'm going to assume that all of you that are logged in right now can see the back office. Now, if you are on a Ericsson computer, I'm not sure if you guys have had to turn those in yet. I don't know what Ericsson computers are blocking. I know we've had some issues with the E&O site it was blocking. I would recommend getting your own laptop. If you're using an iPad or your cell phone, it's just not going to work very good for you. The iPads, even the Android pads, they have some system issues with them as far as working with these platforms. No matter what platform you use, you're going to have some issues if you're trying to use that software. So I would recommend getting a laptop. Doesn't matter which laptop. The only thing, my suggestion is staying away from Apple, just because I can't help you much because I don't use an Apple myself. So anything outside of that, if you get like an HP computer or Dell, I don't even know what options are out there anymore. Just get a basic computer. It doesn't need to be a supercomputer or anything like that, but any simple basic computer will work. I work on a HP, or no, it's a Dell, and it's pretty small. I have a 13-inch screen. So the screen size doesn't really matter, but I would definitely tell you to get your own so that way you're not being blocked from certain sites. So you're going to go on here, you're going to click on back office. In your back office, this is where we just went for carrier contracts, which right now you probably see 0 ready to sell. This 2026 RTS in the month of August will flip to 2027. So you'll start seeing a count for the number of ready to sell for 2027. As I mentioned earlier, these carriers aren't really sending us any data yet for 2027 RTS. So if you're like, hey, I did the UHC 2027, what's going on? Well, one, you probably haven't done the contract yet, the new one. But also they won't send us that data till August sometime. The first thing I want you to go on in here is your marketing, view marketing information. So you guys are now all independent. So you can pretty much create your own logos if you want. If you don't know how, I can help you. With AI nowadays, it's pretty sweet. You can literally, I'll show you something really cool. You can go to, if you haven't done this, this is always fun. You can go to ChatGPT. So if you just go to ChatGPT and Google search that, it's pretty cool because, Antonio, I'm going to use you as a demo here. I can basically just say, create me a logo. I can type whatever I want in this for Antonio. Jeez, I got to spell it right. Antonio that markets Medicare. What state are you in, Antonio? Was it Texas? Texas. Texas. Make it funny. Include a horse and red and green colors. I have no clue, but that's what we're going to come up with. So I just type this and literally this ChatGPT will create me a logo. So the nice thing with AI nowadays is you guys can create logos whenever you want. You can create company names, or you could just not have one. You don't have to do this. I'm just giving you guys an idea. And with technology nowadays, it's pretty easy to create logos in seconds. Well, maybe this will be 30 seconds, but so right now what it's doing is it's creating a logo. Now, obviously, what I would tell you to do is when you create these logos, if you already have a business name, you don't have to file an LLC. But if you want to be DeSantis Insurance, great, let's go with it. So say my logo is going to be DeSantis Insurance, and I like to sit on the beach and I like to help people with Medicare. It'll literally do it. So Antonio, this is your logo. So literally in seconds, I have a logo. Now I could go back and say, okay, this is not professional and change it. The nice thing with ChatGPT is it will do it all. So I could say make more professional. And I'm not going to spend more time on this, but it'll basically go back and change it however I want. So that's how we create logos. I had to do this for an agency of 500 agents, and each individual agent wanted a logo. I'm going to tell you right now that would take forever for a marketing company. It would cost tens of thousands of dollars. But in ChatGPT, we literally did it in a couple hours. So you guys, if you want, if you don't have anything, you can do it in here. Now I'm going to go back. So let's talk marketing. The first thing when you're on the marketing tab, I want you all to do is click on profile. Okay. This is where we're going to put in any business information we have. So more than likely you guys, I think you probably see the Spark logo or our logo. We want to get rid of that. There's a couple options. If you've created a logo already, just put edit and you can put in your logo. So I can change logo and put in whatever I want. So if Antonio is going to use my horse logo, um, he could do that. So he could use this logo if he wanted to. And all he would do is click on change logo and upload that. If you don't have one yet, no worries. I have agents that have been an agent for 10 years and still don't have a logo or a business name. That's not a problem. If you want to do this, you can. You can also change colors. Rick is obsessed with Michigan State basketball, so everything we do is green and white. But if you're like, nope, I don't want green and white, you could change it. The other important stuff there under profile is your personal information. I am a big fan of agents using a picture, especially when dealing with seniors, is most of the time they don't remember your name, but they will remember a picture. So I highly recommend doing a picture. Now, I've had a lot of agents tell me, I don't want to pay for a professional picture. Okay, well, that's awesome because ChatGPT will do it for you. So you can literally, I did this last week or a couple weeks ago. You can go to ChatGPT, and I'll show you something really cool. Uh, and you can upload any picture you want. Let's see here. So I went around my office and I did this for something. I says, hey, I need headshots of all of you. So I literally took like pictures of everyone in the office. So I didn't give them a heads up so they couldn't do makeup or anything. I said, I'm taking a picture on my cell phone. So you guys can do this in ChatGPT. Just sitting at your desk, take a picture on your cell phone, go to ChatGPT and say make professional. And you could see instant literally what it did. That's why you probably hear from people nowadays, don't believe anything online because you can pretty much do whatever you want nowadays. So you can see I did a few here. I mean, I literally did my whole office. So it's one of those things like, I mean, you could, so this is a way for you guys to not have to pay. I'm trying to save you money. No reason to pay for a headshot because you can do it in AI.
Hey, Dustin.
Yes.
Hey, quick question. Going back to the laptops, I know it was kind of cutting out. Now, are you saying the Mac or Apple is not supported, or in terms of you helping us, you're not able to assist because you're not a Mac guy?
Yeah. So it's supported. So if you have a Mac computer, that's fine. I just don't know how to
Okay.
use it. We have agents that use
Okay.
Apple computers, and they'll call me sometimes, and we'll try fumbling through it. But I just
Okay.
know that there's a lot of buttons that are different.
Gotcha.
But I'm
Okay.
not saying you can't use it. We have agents that use them for sure.
All righty. And then secondly, on this Spark website, you were saying change the logo. Is this being seen by outside people, or is it just seen by me as an agent? In
This
terms of
is,
having my logo on this.
yeah, depending on how you use the system, and I'm going to show you some things that you can use it for.
Oh,
It might be seen
okay.
by outside people, but that's up to you if you enroll in the platform features. So it has
Okay.
automated like marketing stuff it'll do for you. And so you can turn it on or off, but if you turn it on, you probably want to have some type of logo and your picture on it.
Okay. Thank you.
Yep. So you guys are going to edit your personal information. You want to put in your office line, probably your cell phone, I would assume most of you are using. You can update your name. Your email is not going to be changed. If you want to change your email, you're going to have to email me, and then we can get it updated because this is tied to your login. But everything else you can change. Your address. You can put a picture. You can put a website if you have one. And we're going to talk about websites in a second here. Facebook you can put in there if you have a scheduling, and I suggest you do this if you haven't. You can use Calendly. I'll put it in the chat, and that's like a online scheduling. I don't think your existing clients will probably use this, but if you are going after turning 65 people, I'll put this in the chat. Calendly is a pretty cool like automated. Oops, sorry. Uh, site where people can schedule appointments with you. So you can basically for free schedule 60-minute time slots, and it will connect to your Outlook calendar. So if you want to get techie, you could use this. It makes it a lot easier for people to schedule appointments with you. But you could put that Calendly link in here, so that way everything that Spark sends out to your clients, if you're doing that, will have your link to schedule an appointment with you. All right, I'm going to go back. And again, if questions, throw them in the chat, stop me. Otherwise, I'm just going to keep going. So once we've updated our profile, we're going to talk about materials. So I've had a couple emails from people about like business cards, flyers. We can create anything you want. With AI and everything else nowadays, we're pretty much creating tons of stuff. I had someone the other day, and I'll show you, said hey, we need a Medicare Advantage plan with hospital indemnity flyer. So we're creating this right now. It's not finalized, but they basically wanted to have 3 options for an indemnity plan to sell with Medicare Advantage. So we can create this as quick as you want. You tell me the colors. Sometimes I'll have agents say, hey, I want my headshot in it. We can do all of that. You just got to let us know. But some of this stuff is automated on Spark. So a couple things I'm going to show you. One is business cards. So if some of you are just saying, hey, I just need basic business cards, where is it? You can go under here, and there is going to be an example of a couple business cards. All you had to do is click download, and then I use a company called Zapier. I upload it to Zapier, so I'll show you. I'm going to click download. And so now it's downloaded it to my computer. If I go to the website Zapier, this is Zapier. Maybe it's not. No, it's not Zapier. I'm wrong. Sorry. Zazzle. Zapier is an AI platform. Don't use that. It's a Zazzle. Can you guys see my Zazzle screen? Okay. So you go to Zazzle, and all you have to do is basically business cards, and I can go in here and pick business cards that I want, and then I just load the business card that is saved to my computer, and I just hit print. It's as simple as that. Or if I want to design one, I can. So I just click this, get a coupon, and then I can literally just say upload once I start this, and I can upload my business card that I just created. So again, we can help with this, but that's usually where our agents are going to order business cards from, is through Zazzle, because it's the cheapest, one of the cheapest ones out there. Did I save it? Well, oh well. So, and then basically once I load it here, I can just print it. So if you want business cards, that's the quickest way to do it. There's also BRCs, like if you want business reply cards on here, they're all templated. They all have your information. There's mailers, there's flyers, there's PowerPoints. So what happens is once you put your image in there and your phone number, everything is templated to your information. The other thing I want to show you here is your website. So by updating your profile, you're going to automatically get this website here. This is free personalized website. I'm just going to copy this and show you all. So basically it's very simple. It just talks about you, some basic information. I mean, it's very basic. But it gives you a website so people can look you up if you wanted to. I also have agents that always ask, do you have a more professional website? We have a company that we partner with. It's $100 a month, so there's a cost to it. But if you want to actually build out a professional website and you're not sure how, and you got to worry about all the CMS regulations and everything else, if you go to our RYIS.org website and click more, password hasn't changed. It's capital R, capital Y, 2026. I'll throw this in the chat also. Once you're on here, there's a thing right here. It says website company with RYIS discount. This company has a website you can use. It's automatically created. It even has a blog. Everything you need to do is right on here. They just charged our agents $100 a month, but it's for you to have a professional website. I'm not saying it's needed. I always tell agents that your website's probably not going to make you any money. It's just one of those things that some agents want to have. So completely up to you on that. But Spark does give you a free one if you want it. Okay, so now we've set up our materials, or we have our materials such as business cards, flyers. We've changed our profile. The only other thing I want to show you on this tab, the marketing tab, is sources. So I'm not going to tell you to do this day one, but eventually I think this would be a great way for you guys to track your marketing activities. So if you're going to start doing events, or you want to post up on social media, this is a great way to track everyone to that social media post. So I'm on marketing and I click sources. Let's just say, for instance, I'm going to post something on Facebook on October 5th, talking about AEP. All I need to do is go to sources, add source. I'm going to say Facebook post October 5, 2026 for AEP. Add source. What it's going to do now is it's going to create me this source. So when I post my picture and talk about AEP, I could get a link right here that now if anyone clicks on that link, it's tracked in my Spark system. So if someone clicks on this link, I'll show you what it looks like. So I posted something on Facebook, they click on the link. When they click on it, it's going to bring you to this page, or them to this page. And now they can fill out this information. It'll automatically populate in your Spark platform, and you'll get a notification that you now have a lead. So it's a way for you to track it. And then what it'll do is in my Spark platform, if someone did that, is I would actually get a contact here. So if Antonio clicks on my Facebook page, he fills out the form, he's now going to show up in my Spark platform. And so it's all automated. So it's a way for you guys to track everything. Someone asked about an Ericsson presentation. We have to be careful because of CMS rules on that stuff, especially once you're going to talk about a certain carrier. If you want, we can work together as a group creating that. So I could probably pull in Mike a little bit on this, but we could create a presentation and then have it as what are your next step. Oh, that is Mike. Yes, Mike. If you create that, I can't load it to the system, but I can make it personalized for all the agents. So yes, we can definitely do that. I think that's a great idea. I don't know if you guys are able to do presentations in the facilities, but that's probably going to be a good idea just to get in front of groups, or we can invite them to webinars. I don't know how many of those people would actually join a webinar, but we can definitely personalize it for each one of you.
So I have some information from earlier this morning. So we are going to be able to do presentations. So I'd like to get it loaded if we do it outside of the platform or whatnot, but still get their personal information in there. That'll be a great opportunity.
Yeah, I think that's a great idea. Will that, Mike, if you guys are creating the presentation, are you filing it, or do you want us to have it sent through our compliance channels?
That's what I need to work through, because we
Okay.
do have to get it. We do have to get it filed. I would rather do it outside of EA.
Mm-hmm.
So,
Okay. Yeah. If you can create that, and then if you want to get it to me, we'll send it through our channels and get it reviewed.
Perfect.
Okay. So source is just a cool functionality or function in the system. I'm going to go back to the back office. The other thing in here that eventually you might want to sign up for is the client retention program. Okay, so I'm going to click on this, and you won't even be able to do this until you upload your picture in there, but there's some pretty cool things it'll automatically do to help you guys long term. So view retention campaign. If I go to this page, there is a learn more button right here. So if I click that, it's going to show me what's available. So what Spark does is they will set up automatic programs for you. Most of them are free. There's one that would charge you. So it's up to you if you guys want to use that, and I'll show you that in a minute. But what is nice is when you guys do enrollments through this platform, it's going to automatically send your clients a new plan enrollment postcard with your information on it. It's going to have your picture on it. It's going to say, hey, thank you for enrolling with me. It's automated. You don't need to do anything. You don't even pay for it. So, but this will only happen if you sign up for the retention program. What it also does is it'll send your clients an automated email if they get email. It's a newsletter every month, and what they do in the newsletter is they'll talk about what's going on in our industry. If it's Life Insurance Awareness Month, it might mention that. What it also does is it gives them coupons based on their geographic area. So it does a zip code search, and it automatically attach coupons. Again, no cost to you. It's automated, so there's no reason why not to use it. We have had agents that have sold a lot of life insurance just from this newsletter, and it's free to you. AEP campaign, this will not impact you guys this year, but next year they actually will send, I mean, I guess we could use it this year. So if we load your clients, it's up to you if you want to turn this on, because some agents want to stay away from it. But what it does is it'll automatically send out a postcard and an email to all of your clients letting them know it's AEP, and they should populate the survey that I'm going to show you in a couple minutes. The survey is basically you capturing their drugs and doctors. So most of our agents kind of stay away from it because they don't want every single one of their clients calling them. In your guys' situation, you kind of do. So maybe this is something we want to look at. We'll talk through that as we move on. This is all free. Yes.
Dustin, I saw that, and that's one that I think if we get the clients loaded, that we actually should do. We just got to worry about the timing.
Yes. And I'm going to show you guys loading clients here in a second, so we can start working through that. The next thing is the birthday cards. This is the only thing that costs you money. So I always tell agents, like, make sure you're aware of this. If you sign up, you're going to get charged $250 for each birthday card. Now, if you were to go do this on your own, they're handwritten birthday cards. If you were to doing this on your own, I've had agents tell me they're paying $4 to $5. So it's pretty discounted. But if you don't do birthday cards now and you don't want to mess with it, that's fine. So I'm going to go back to this page. So I can click when I want to enroll in. So I could, for instance, I only want to do the newsletter. Great, you can do that. Or I want to only do the new plan enrollment. So you can choose what you want to enroll in here. It also, we'll talk about Google here in a couple minutes. You can also select that everything has your Google review page on there. If you haven't set up a Google review, we can work on that. But you can choose. Now, before you can even choose the client retention program, you have to set up your profile with your picture and everything else. Questions? Okay. So those are the two most important things. So far, I've clicked on back office. I've gone through marketing information, and we've talked about client retention outside of carrier contracts. Now I'm going to go to the most important page for you guys is your contacts page. So when you click on your home screen, oh geez, don't kick me out right now. Okay, so when you click on your home screen, let's see if this works. All right, we're not going to click on the home screen. When you click on the home screen for you guys, you should see something that asks you to load your book of business. So when you go to your home screen, you're going to all see that. You can also see that when I click on contacts, geez, you're going to also see that. You know what? I have too many things open. Okay, we're going to try this again. I just realized if you open the link for Spark for yourself at the same time as you're logged in, it kicks you out. So we are gonna get back in here. Give me a second.
Dustin, while you're doing that, can I ask a quick question?
Yes.
This is Jennifer Simon. I'm sorry I jumped on late and I have to jump off early because I have client meetings all day.
No worries.
But one of the big things I'm trying to figure out is having a phone number, and I understand there's a way to do that through you. Have you discussed that yet, or will that be discussed in the future?
That is going to be discussed here shortly. I have not discussed that yet.
Okay, but you're
this is going to
recording
be
this, so if I have to jump off, I can go back in and get
yes,
this. Okay.
yes.
Thank you.
I will.
Thank you.
As soon as we're done here, I will take the recording, throw it in a YouTube channel, and send it out to the group again.
Great. Thank you so much.
Yeah. All right. Let's see. Why can't I get back in here?
Justin, on the client retention section, what was the plan exit tab?
So you can get notified by email if carriers are exiting markets. I have not had any agents using that yet.
Okay.
And as new agents, especially when you know all your clients are having their plan exit, I would not do that right now because I'm afraid it's just gonna create extra work for all of you.
Gotcha.
All right. Sorry, I'm trying to get back in here. You can see I was doing a hospital indemnity quote. We do a lot with Medicare Advantage, a lot of hospital indemnities, and we'll talk about that too. I'll probably have my Rob in my office do a training for all of you on cross-selling. Especially nowadays, we do a ton of cross-selling. So let's see if this is going to open. It's funny, I never log out of, because I use the agency logins, I never log out. And now that I did the Pearl or the URL on the same page, it kicked me out. So we'll see what I can do here. Why I'm doing this, is there any other questions?
On the business card, the Zazzle, when we click print, does that mean that they will print it with the hard copy paper and then they'll mail it to us? Okay. Just
Yep,
like
you're
this.
you're basically ordering your own business cards, so they'll come on, and you can pick like, I want them on shiny paper, I want them on cardboard, I want them as cheap as possible.
Okay.
I am not a big fan of business cards because people would just say, well, hand me a business card, and they never call you. And so it's one of those things like when I was an agent, this is a long time ago, I would just say, darn, I just handed my last business card out. Let me get your information. That was kind of my strategy because I just never wanted to hand out business cards. When I would go to networking events, Mike, I might have ran this by you one time, but when I went to networking events, I actually punched a hole in my business cards. And when I would hand out my business cards, everyone would say, why is there a hole in your business card? And I would basically come up with some funny tagline like, well, I'm here to help fill the hole in your financial plan or your insurance plan. And so something different just to get their attention so they would remember me. But the problem with the business cards is it's an out for most people, and they'll just say, hand me a business card. They're never going to call you. So just try to get their information. And we're going to have some fun because this is not letting me in. Give me 1 second. I'm going to pause real quick. I'll be right back. Okay, why I wait for that, because for some reason we're not getting a code to log in, I am going to skip to something else. Actually, I might try this one more time. Oh, now that I've tried 10 times, they're like, we got like 8 codes. So let's try this. Okay, woohoo, we're back in. All right, so on your guys' contact page, if you click on contacts, this is where you're going to upload your book of business. Okay, so yours is going to look a little bit different than my screen, but I want to kind of talk about this. So if you guys are logged in, if you click on contacts, does everyone see the spot where it says upload book of business? Yes, some not nodding. Okay. So what I want to tell you is once you get there, you only get one chance to upload your book of business. And if you say no, it doesn't come up again. Because some of you, I know, I've done this many times. It's like, well, I don't want to do it now, so I'm just going to click no. If you've already done that or you don't see upload book of business, just shoot me an email afterwards. I can get it reset for you. You get one chance to upload your book of business. And the reason for that is they take all the data and they filter it all and put it into the format for Spark. I've had agents that accidentally uploaded the wrong spreadsheet. Don't worry, we can always work through it. It just delays things a little bit. So the most important thing for you all right now to make your lives a lot easier from a system standpoint is getting your spreadsheet from Ericsson, which I think most of you have done already, talking to a few of you. If you haven't, you want to. So you want to get your current book of business in a Excel file or CSV file. That's the only spreadsheet we're going to load, except for I think there's one on here that might have clients in other carriers. If you have clients, just get all those spreadsheets. So anything you guys want to load into this, that's a client. Don't load prospects. That's going to get you in trouble. So we're just loading your existing clients. So if you have a couple clients with Aetna for some reason or another, whatever that might be for, I think one of you on here, get all those carrier spreadsheets. You can upload them all at the same time. You don't need to change any of the formats. As long as it's in Excel, I'm going to load it. Once it's done loading, I'm going to hit submit. What Spark is going to do then is they're going to take all that data and basically put it into the format here. If it has the MBI on it, that's the data. I think we had talked last time it does. That even makes it better. But the more information we can load, the better. Once you've done that, or even now, we can play with it. So the first thing we're going to do today is I want you to load yourself. We're going to make up this information. I can't see your screen, so don't worry about that. But the first thing you can do is we're going to do a sample person. If you've already done yourself in there, do someone else. Just make it up. So we're going to go to add contact. Now, what's really cool about this system is if you have their beneficiary lookup, the system will automatically pull it. So give me 1 second because I am going to show you how that works here. I have a dummy one, so just give me 1 second. So if you don't, say for instance, you're meeting with someone that's brand new to Medicare or they've lost their Medicare number, then you can do it another way. But we're gonna do, let's pretend I have one. Actually, give me 1 second. I'm actually gonna do a real person because it is a lot cooler what it does. So I'm going to use my mom's information. Please don't call her. I'll get in trouble. Don't write this down, but I have used my mom's Medicare number for thousands of agents. So at this point, her identity has probably been stolen, but she'll forgive me, I'm sure. All right. Okay, so what you need then to add a contact is you're going to click add contact. If you have their Medicare number, which a lot of you do, and let's just say they're not in your system. If you're doing the bulk load and they're already in there, you're not going to do this. You don't want to duplicate the person. But let's just say I'm meeting with a brand new person I can basically put all their information in here. Put my phone number, so I can show you what happens. I'm going to put my email address in here. The system won't block you from creating duplicates, so just be careful doing this. So now what I'm going to do is I'm going to hit check eligibility. What the system is going to do is instead of me having to retype all their information, it automatically is going to populate it all. So now I can see my mom's Part A and Part B effective date. It pulls in their current plan. So I can see she's in Michigan. This is her current plan. This is her previous plan. It'll usually go back 12 months to 24 months. So it automatically pull this data into the system. So now it asks, do I want to do their home address? If you don't do the home address, it's not going to let you run a quote as we move through this. So I'm going to actually use her address here. And then it asks if there's a different address. You can put in here veteran status if you want. There's a whole bunch of other information here. You can track your sources. So if I wanted to track where I got this client referred to and I didn't use that sources earlier, this is where I can do that. I'm just going to hit save and exit. So I'm going to give you guys a couple examples. Let's just say, for instance, I'm meeting with this person next week, Thursday. And, you know, before I run my meeting, it would be really nice to have all their drugs and doctors. But the last thing I want to do is sit on hold or have them sit in my office while they fumble through trying to find all their drugs and doctors. So what I can do is actually just send them a survey and it'll capture it. So if I'm in here, I've done all this, I can click send needs assessment. Now what's nice is for you guys, once we load your clients, you're going to be able to bulk send this to all your clients. So instead of just doing one by one, you're going to be able to bulk send it. And why that's going to be important is it's going to allow you to capture all their doctors, also the scope of appointment, which you have to have with all your clients. So all I've done so far is made up a person. Now I'm going to hit send needs assessment. I can choose to send it by text or email. If I do it by text, I have to copy the code or the text URL that's going to give me. So it's a little bit harder to do it that way because the system itself doesn't have a text feature. But I'm just going to, for now, do an email. And I would tell you guys to do this to yourself so you can see what your clients are getting. So that way, when you're talking to them on the phone, you can explain what this process is going to look like. This will also happen in the AEP survey that's going to go out to all your clients. If we're going to enroll on that, it'll automatically send your clients this kind of same survey. So I'm going to hit send survey. And what they're going to do is your client's going to get an email. And once I get it, I'll show you what it looks like. I always tell people sometimes it goes to junk mail. I have this Outlook, and now with Outlook, they not only have a junk inbox, they have a promotions inbox. And so I have to check 3 different inboxes on my Outlook now. This did not go to junk, which is good. So I'll show you what it looks like. Can you guys see the email on the screen? So this is what it comes as. It's very simple. And so this is why sometimes it goes to junk or people don't see it. So this is why I would tell you to, if you're going to use that feature, make sure you explain to your clients. If we're using the AEP program that we talked about a couple minutes ago, that actually sends a postcard to them. So that way they don't miss it. But your client's going to get this. And basically it says Nancy, it comes from Rick Young. They can click start form. I'm hoping this is going to open up in a different browser so I don't get kicked out of Spark again. Good, it's in, okay. So this is what the client gets. Again, it's going to have your information on here and a logo if you upload one. They can hit start survey. It's going to ask them for their birthday. It's got to match what I input in there. If it doesn't match, it's a HIPAA thing. So that's why, so if I made up a birthday, just make sure you remember the birthday you made up. Hit continue. Now they are in the survey. It's going to ask them information. And there's basically 9 steps. And I'm going to go through this quickly so you guys can see what it looks like. So I'm meeting with this person. I already know they have a Medicare Advantage plan with HAP. They're probably paying $0. So it's now asking Medicare information. I already did all that because I entered that before. It's going to ask if they're a veteran. I'm going to say my mom's a spouse. No, I'm not. I don't want to go through the extra steps. Do you have Medicaid? No. Medications. Do you have extra help with medications? If they're LYS, low income subsidy or something, I can put that there. Chronic conditions. So if I want to put in history that they have diabetes, I can actually put that in there. So the client's doing this, not you. Prescriptions. I'm going to just hurry up and quickly add some medications. So your client's doing this. Hopefully they're filling it out correctly as it matches the bottle. What's another drug? Go with whatever that is. Okay, so they're done adding drugs. Now they can add their local pharmacy. Let's just say they're going to CVS. They can add a doctor. There's always a Smith, so that makes it fast too. So now they're getting the question for the scope. So as the law requires, you guys are all required to do scopes. As long as you get a scope and it's within the last 12 months, you're good. So you could actually, as you start doing these, you could start doing these surveys today for clients and capturing the scope, and you're good through AEP because you're good for 12 months. So I can put that in there, the scope. It requires their signature, sign and continue, and now they are done. So I've literally just captured all their information in seconds. Now what you're going to get in your email, which I can't access because it's going to Rick Young, is basically, hey, you have a needs assessment completed. So I'm going to go back here. I'm going to refresh this. So what you're going to see now, if I scroll down, is Nancy completed an intake form today, 10:57, along with an SOA. If I wanted to see the SOA, I could click on this right here and it would open it. So you're wondering, where's all that information going that she just put in there? How do I access that? If I click on healthcare, all that data that she just input is right here. Prescriptions, pharmacy, primary care. If I had added other things, it would all be listed there. Medicare, I could see her Medicare information. I could see that she listed under chronic condition that she's got diabetes. And then the next step, if we want, is quote and enroll. Now, you all, I don't think, would be able to do the quote and enroll. I'm going to show you today. I'm going to record this. Actually, before I go to that, we'll do the phone number thing. But the quote and enroll is tied to Sunfire. So you guys, as you get your first carrier, so as soon as a carrier shows RTS in the system, whether it's UHC, Humana, Aetna, whatever it is, then you're going to have access to quote and enroll that company. Some of these smaller companies, like for instance, I'll mention Braven. Braven, we're doing outside Spark. You'll be able to quote it in here, but the application, if it's a smaller company, will actually have to be done on the carrier website. So we'll talk through that and I'll show you here in a couple minutes. Let's do this and then I'll talk about the phone side of it. So I can now do quote and enroll. I have two options. We've talked a little bit about this, but I have Sunfire, which is mostly Medicare Advantage, PDP plans. There's a couple Medigap carriers in there, not very many though. For Medigap carriers, you're probably going to want to use CSG. CSG is the kind of the main industry standard for quoting Medigap. It's going to have pretty much, well, it will have every carrier that's available. I don't think you guys do a lot of Medigap, and we won't probably spend a lot of time on that, but I know in this situation where these people's plans are being terminated, they do have that one-time guarantee issue. The problem with the one-time guarantee issue that they have going to Medigap is most of the carriers don't pay commissions. There are a couple that do, but they're very expensive. So most of the time, I don't think you guys will be doing Medigap unless you have to. I'm going to open Sunfire. So Sunfire, I'm not sure if you guys have ever seen this, but this is the quoting and enrollment tool. Since you can't access it today, I'm not going to spend a lot of time here because I want to wait till you guys actually can do it with me. But when you're in Sunfire, what's cool is the drugs, the pharmacy, and the doctor automatically carry over into Sunfire. So the information that was filled out on that survey is automatically being populated in here. I don't have to retype that all in. Now this is for Michigan, because I put in a Michigan zip code. So I can see all the plans here. Let's just say, for instance, the client is asking for a carrier that I don't see here. Maybe it's one that's not in my, I didn't do it through Spark to get contracted. I can just uncheck this box, appointed only. It'll show every single carrier that's available in that zip code. What's also nice about the system is hopefully next year we don't have as many non-commissionable plans, but it'll tell you if you're not going to get paid. So the system does update like which plans pay and don't pay. So you can kind of see that here. I can filter by PDPs, special needs plans, DSNP, CSNP, whatever I want here. I can filter by carrier. So if I'm only going to show Aetna, I can filter by that. I can filter by HMO or POS, any of those information I want. What I can also do is, let's just say, for instance, I'm looking at this Humana plan. It'll tell me, based on the drugs I put in there, the estimated drug cost. It'll tell me how many of those drugs are covered. It also tells me if the doctor is in, which in this case it's not. If I wanted to see more details on this plan, so I'm looking at the SNP plan, I can hit X-Array. This will allow me to see details of that plan. So I can do a deep dive in the drugs. So if I click drug cost details, it's going to break down all of the drugs, like by month, however I want to do this. And then I can click enroll.
One that's not covered.
Yep. I just saw it. This one right here, I have no clue what this drug is. The O something I put in. It's not covered. And then it tells you like some of these drugs, it'll tell you what the estimated full drug cost is, not what I'm paying, but the full drug cost. And then if I scroll down, it'll tell me what I'm going to pay each month. So this is showing January, which someone enrolling in the month of August wouldn't want to see that because that's not going to help them much. So right here, time period, I can switch my effective date to August 1st. Now it's going to recalculate those drug costs based on the August 1st effective date. So now I go to X-Ray, same thing. And now it's going to show me the drug costs starting August. And you can kind of see the cost share. We'll spend more time on this when you guys have access, because right now none of you can see on your own screens what I'm doing, but just something to work on. All right, I'm going to go back to this. The only other thing I want to show you in this person is, let's just say, for instance, you enroll the client, it's February or March, and now the client calls you and says, my provider just retired, can you help me find a new doctor? I don't know, you're probably not going to get a lot of that with Erickson, but let's just say that happens. You can actually have Spark do the call for you, and they will do it on your behalf. So it's a way for you guys to reduce your customer service issues. I always tell agents, like if it's ID cards and stuff like that, you probably should do it. But if it's something that's going to take you a while, have Spark do it so you don't have to. It's all done in the United States. It's not overseas. They represent you, so you're not going to have to worry. I've never had agents complain about using this. But if you just hit client support, and I can basically put in a, where is this, request, and then what'll happen is Spark will call this person saying, hi, I'm calling from Jennifer Simon's office. We're here. We see that you have an issue with your PCP retiring and you need find a new provider that takes your plan. They're literally going to call on your behalf. So it helps you guys kind of off some of the customer service stuff that you don't want to deal with, the time consuming part. All right, we are going to go to, let's see here, the phone system. So, a couple things I want to tell you. One is not a lot of agents do the phone call recordings through Spark. Okay, you can, but I'm going to give you guys some secrets. How many, well, I guess we don't need to do this, but if you have an Apple iPhone, I highly recommend you use Apple for your recording feature versus Spark. The reason for it is it's easy. Someone calls me, so you can look at your cell phone. If someone calls you while you're talking to them, you can do this with a friend or family member whenever you want, but if you're talking to them, you're going to see on your screen on an Apple phone 6 buttons basically to push. There will be one that says more with 3 dots. If you click that more button, there's a button to click record. If you record it, what it's really cool, what I love about the Apple is it not only records the whole call, but it actually transcribes the entire call and saves both in your notes. And it's right on your cell phone. You don't have to do anything. I don't have to have them call a different 800 number. I don't have to do anything. And then what I can do is once it's saved to my notes is I can basically attach that to my Spark profile for the client. So we have, I would say a majority of our agents, the ones that are using Apple phones, are doing that. I don't, Android doesn't have that, but there is a platform a lot of our Android users called Tape a Call that they download on their cell phone you can use. Now I'm going to show you the Spark option here in a second, but that is one way to do it. Where is it? We got to remember how to get to this. Where are you? Okay, so if you guys are on your home screen, sorry, I had to remind myself where this is. So if you're on your home screen, you're going to see that if you scroll down, there's a little button at the bottom that says setting. Okay, so if you're following along, you can click on setting. And then on the right-hand side, there's communication preference. This is where you can enable the call recording. What it's going to do is, I'm just going to actually do it right now, is once you do this, it's going to basically give you a phone number, and you can see how much you get there. You get 150 hours a year. Never had an agent use more than that, but it's 150 hours free per year. And that's calendar year. I hit activate call recording. What it's going to do is give you a phone number. Okay. Anytime someone calls that number, so if I'm talking to them right today and I need the phone to be recorded, I'm going to say, okay, I need you to call this number. Client calls that number. Any conversations that take place on that phone number are recorded and tied to your Spark platform. The reason a lot of agents don't do that is because they don't want to have to hang up on the client and have them call a different number. But if you have to record your calls, you only have to record calls if you're doing a enrollment over the phone. But if you're going to do that, that is how you can do it. And this costs you nothing because I don't think any of you will hit the 150 hours. That is option one. Or you can do, if you have an Apple phone, you can use the Apple thing. That's what most of the agents are doing nowadays. If you don't use an Apple phone, you can use the Tape a Call as a third party. It's like $10 a month if you want to go that direction. Does that make sense? So we went to settings, communication preferences, and I click enabled. It's as simple as that. Questions on that? Now, I go back to contacts. If I created a contact like my mom, which I've created 25 times in here probably, I don't want it to be in here 25 times. So I just click on delete contact. And it's going to be removed. I would tell you to use your cell phones for everything you give out. Especially with you guys, most of the time you're probably going to be doing your meetings, like especially to start at Ericsson at the facilities. If you're not, most of our agents we still, I would say, I see most of our agents running everything in person. At least the enrollments, they're still doing everything in person. But if you're gonna do it over the phone, you're gonna have to have them call that number or use the recording on your cell phone. The government is not as picky as they used to be on the recordings. It's all changing for this upcoming AEP, like all the rules around that. But if you're going to do the actual application, you should record it. And that is the way to do it. Questions?
Did you say the Spark system will pick up the duplicates and merge them, or if I put 5 people in there inadvertently, will it not? I will just have 5 of the same folks. Is that what you said?
Yes, it will not do that. So for
Oh,
instance,
okay.
you can see here, I've created a lot of templates of myself in here. It doesn't connect them, even though the birthdays are the same. The way the
Okay.
system is set up is they don't check for duplicates at all. So when they load your book of business that first time, when you guys, they're going to load everything, they check for duplicates. So I would tell you, like, hey, if you're going to load your book of business, don't put any of those clients in yet, or you're going to create duplicates for yourself. If you're like, I only have 20 clients, I'm pretty new to this Erickson thing, maybe just do them yourself so you don't have to wait. The book of business load this time of the year, I'm going to say is going to take 3 to 4 weeks. Because again, everything is slow right now. So if you load them, for instance, you don't even have to have your contract active yet. So that's something you guys could actually do like this week if you wanted to. If you're in Spark, just click on and you have your book of business. You could load those now. You don't need to wait for anything to come through for contracts. But I would say it's probably gonna take 3 to 4 weeks. Again, I have you guys all on a list that we're kind of trying to push things through. But I wouldn't wait until the 3rd week of September to do that.
Gotcha.
Any other questions? The only other thing I could show you here that's pretty cool is you guys, once you sell something, if you're not doing the enrollment through the platform, through Sunfire, you'll have to manually add the policy information here. But if you do, say, a Humana enrollment right through the platform, it'll automatically show up right here. So you don't have to do anything. So you'll see it. But if I want to say, for instance, I sold the person a hospital indemnity and I want to track it in the platform, I click add policy. I can say it's a hospital indemnity. I can select the carrier if it's listed here, and I can load it there. So it's a way for you guys to track not just your Medicare Advantage sales, but we can track Medigap in here. We can track pretty much anything. So it's a way for you guys to use it as a CRM. Trying to think if there's anything else in here I want to go through today. Other Spark questions? Okay, so from today, kind of a recap on everything. Contracting is kind of the holdup right now for most of you. We're waiting on that. You guys don't need to wait for contracts though to get your books of business loaded. So if you log into Spark, hit the upload book, upload your Excel file, that is something we might as well get going on. If you click on your back office and you go to view carrier contracts, and under pending carriers, you're missing a company that you really want. For instance, Clover might be missing for you. Shoot me an email so I can track that. So if you're looking at yours and you're like, I only see UHC and I want Aetna and Humana and anything else, send me an email so we can kind of work through that. Some carriers will not show up in Spark ever because they're small and they just don't want to be on platforms. Some carriers we haven't ever asked for before, so we have to request it. But we're going to work through that and get whatever carriers you want. But just make sure that if it's a carrier you want, it shows pending at this point.
So Dustin?
Yep.
If I think I emailed you 2 carriers that I wanted to add for New Jersey, but they're not showing in my Spark yet. Am I just waiting? Because that's really hard, but am I just waiting?
Probably.
Okay,
Let's see. What I have so many emails. What
I know.
were you looking for Braven and Independence, or was that?
I was Clover, I think it was Clover and Independence, Blue Cross of New Jersey, yeah.
Send me another email so I can
Okay.
keep it at the top. But yes, we are working on both of those, and they will be
Okay.
outside the platform, so you won't ever see it. But just since I'm gonna start the spreadsheet I'm building out for you guys, if it could be at the top of my inbox, that would help me.
Perfect, thank you.
Anything else for today? All right, if you guys need anything, I'm gonna throw my cell phone in the contacts. You can text me, email me, call me, whatever you guys need. I have to fly out to Salt Lake City in the morning for a Spark meeting, um, but I will be available. So if I don't answer, just please leave me a voicemail, and I will get back to you. Otherwise, shoot me a text or email, and we can set up a call. So if there's nothing else, hope everyone has a wonderful week, and we will all talk soon.
All right,
Thank you.
thanks.
Thank you.
See ya.
Thank you. Bye-bye. Whew. Okay, babe, I'm gonna get out here. If you want, those other two stuff, if you want them. Huh? About 3 or 4. I'm hoping I'm gonna try to do that. Okay. Not too bad. I'll call you when I get to work, okay? Yeah, let me. Yeah. Okay. I had a Zoom call, so here we go.